On stories that are making headlines, we understand that our reporter Purity Museo is on location at Mbagathi. Let's have a listen into what nurses and clinicians are saying in regard to the state of our healthcare.
Infections among health workers, and subsequently the reason as to why we are losing even very young clinical officers and nurses and doctors and lab officers and the others who should not actually be succumbing to this, because we are forced. Like now, for example, where we are in Mbagathi, they have employed some clinical officers, nurses and other health workers under contractual terms in the guise of furthering the universal health coverage. They are paying them half of what their colleagues earn. They do not have any risk allowance. They have never enjoyed any COVID-19 emergency allowance. They are not part of the medical cover that the other day you saw the Minister for Labor tell Kenyans about. They are not provided with the right PPE, yet they are being forced to work under unsafe environment, and they are being threatened with being sacked. We have also seen from Tharaka Nithi, from Makueni and some other counties that they want very immorally, and I must say that it's very immoral, to use the law to compel our members to go and work under this unsafe environment. And we want to put them on notice today that if they are going to use the law, we also do know how to use the law. Section 14 of the Occupational Safety and Health Act says that for any employee who feels that the working environment presents imminent threat to their health, they should be able to report to the occupier immediately and vacate that environment, and should not resume work until the environment has been made safe by the occupier. And the occupier in this case is our employers as the county government, the NMS, and the Ministry of Health. So what we are going to do, for those who have used the law and gone to court, we will be reporting as early as tomorrow to the employers that the environment is unsafe, and we are going to withdraw our members immediately until the environment is made safe. And by safe I mean until they provide them with a minimum of an N95 mask every day, goggles or face shield, and an apron. They must pay them so that they can be able to get nutritional supplements to boost their immunity. They must be able to pay them.
Demands are there presented by the Kenya Union of Clinical Officers Chairperson Peterson Wachira, who further on alleges threats and intimidation of nurses and clinical officers